Here's an eye-opening fact from Harvard Health. While men typically face shorter lifespans and higher rates of severe chronic illness, women live longer, but they spend nearly a quarter more of their lives in poor health or dealing with disabling conditions. So to wrap up Women's Health Month, we're discussing the disparity between men and women's health.
Yeah, a really important topic. We've got Dr. Ashley Perkins from Community Health joining us to kind of break all this down. You know, I think one of the things I always think about is they talk about like men and women having different symptoms for heart attacks, and women, it's not as obvious. So what is kind of causing this gap in health care for men and women?
Yeah, absolutely. It's one of those things. In medicine, most things don't have one answer, but some of the causes are related to access to care. Especially in our rural communities, we're seeing that women have to drive further and wait longer to get access to those appointments. Also with historically with research, women have often been excluded, and that has been to really try to streamline the data points. When we include women in that data, we have to consider where they are in their lifespan, in their reproductive years. Are they trying to conceive premenopausal, perimenopausal, postmenopausal? How long have they been postmenopausal? So it makes it a little more complicated to get that data, and that has created some knowledge gaps for us as physicians as we try to navigate these diagnoses and these presenting symptoms for women.
Yeah, it's frustrating that the research doesn't seem to be on par or at least comparable to where the knowledge and information we have about men. So we know we have these studies. You're hoping that that impacts policy and the way you all are trained and taught as medical providers. But what can we do as patients to better protect ourselves from this information, this stat?
Yeah, so that's the good news. I think there are things that patients can start with today. One of them is making sure that you're established with a physician that you trust. So if these symptoms come up, you know who you're going to call and who you're going to see. Secondly, it's really important to make sure that you're staying updated on your screening exams. So things like pap smears for cervical cancer screenings, your mammograms, bone density scannings for osteoporosis or low bone mass, colonoscopies. All of these things can be treated and diagnosed early and really go a long way to not only increasing your lifespan, but your health span as well. And then finally, the things that we all know we should do, but are easier said than done, moving our bodies more, eating more fruits and vegetables, really establishing and maintaining those important social relationships, as well as protecting your sleep.
I think a really important topic when we're talking about women's health care has to do with so many women feel like maybe they aren't being listened to, they're not being heard when they're in the room with their doctor. I've seen a lot of people talking about that, at least on social media, sharing their own experiences. So I guess what can women do to, maybe better advocate for themselves, but also what has to change within the healthcare system when it comes to that?
Yeah, so there's a lot to that question. But I think first of all, just being aware that there is this gap, and it is frustrating both for us as physicians and, as you just described, for a lot of particularly female patients to come in and face that. But getting in, establishing that relationship, and I think also not waiting. If you have a new symptom that comes on, don't wait to follow up on that. Really get in there. We know it's going to likely take women longer to get an accurate diagnosis and start accurate treatment to feel better. So get in there, make that appointment, and establish that relationship.
What are you seeing in your practice? Do you find that women are waiting longer or burying their symptoms? What do you see firsthand? Because when you say, just advocate for yourself, ask questions, it sounds like a no-brainer, but the fact that you have to say it means that it may or may not be happening as appropriately as it should.
Absolutely. Fortunately, we are seeing a lot of discussion, and some of it is driven by social media. And I think particularly around menopause, a lot of women are educating themselves. A lot of physicians are also educating themselves and trying to gain that extra knowledge so that women aren't facing these delays in diagnosis. But there is a lot of overlap in symptoms, but we're constantly looking at our schedules and trying to increase access to care for patients. And really, I think it is just that awareness, both from the patient standpoint as well as the physician standpoint, that these gaps do exist.
Certainly. I love that you're bringing up menopause, perimenopause, postmenopausal, because so much of women's health is focused on the childbearing years. But there's a lot of life left
There's a lot
outside of
that.
that. Yeah, especially if that's not the journey you choose. All right, Dr. Perkins, thank you so much.